Jillian Thomas. I'm the Senior Nursing Lab Assistant. It is September 17th at 11:30 and I'm about to check some girls off.
Hi, my name is Megan E. Carey and I'll be the student nurse today. And this is my patient. If you want to read your consent form.
I, Hannah Zachary, hereby give my written and verbal consent to be filmed in the Liberty University Nursing Exam Suite in the Nursing Department at Liberty University as part of the Nursing 210 Adult Health Assessment Nursing 221 Fundamentals of Nursing course. I understand that in giving my consent to be filmed, I also give permission to the film containing my image to be submitted to a secure YouTube site viewable by the nursing student and instructor of the course. I understand that during the examination and filming, areas of my body will be uncovered, exposed, inspected, palpated, and consulted by the student nurse. With this understanding, I give my consent.
All right. And she's already signed the contract. So hi, my name is Megan E. Carey. I'm a Liberty University student nurse, and I'm going to be your nurse today, and we're going to be assessing your eyes. Is that all right with you?
Yes.
All right. Can I have you please verify your name and date of birth?
I'm Hannah Zachary, January 23rd, 1995.
All right. And I've already practiced clean hand hygiene by washing my hands before I begin this exam. All right. So upon inspection, I see no nystagmus, which is a twitch of the eye that you get from lack of sleep, and I see no strabismus, which is otherwise known as lazy eye. And so now I'm going to check the pupil condition and response to light. So I am going to have you look at my finger. All right, and the pupils constrict evenly. And so now I'm going to have you look at a far off distance over my shoulder. Now look at my finger. And the pupils react evenly. And now I'm going to assess the lacrimal gland. So, does anyone I'm touching feel tender?
No.
All right, and I see no edema, drainage, or dryness. And let me see. The lacrimal puncta looks to be a normal dark color, and when I palpate it, it expresses no exudate. So now upon inspecting the orbital area, I see no sagging, drainage, edema, or any lesions. And so now looking at the eyebrows, the eyelashes, and the eyelids, they look to be symmetrical on both sides. The eyelids cover the top part of the iris, which is good, exhibiting no exophthalmos. The eyelashes and eyebrows look to be even in distribution and average in quantity, and they look to be a dark brown color. So now I'm going to assess the sclera and the conjunctiva, and they look to be, the conjunctiva looks to be clear with no red, and the sclera looks white with minimal blood vessels showing, and I see no also with the eyebrows and the eyelashes and the eyelids, I see no tremors, ptosis, flakiness, lesions, or edema or inflammation. And with the sclera and the conjunctiva, I see no discharge or corneal arcus or what else do I not see? Foreign bodies, hemorrhage, or any pterygium. Let me see what else. I'm going to assess your corneal clarity now. So if you just look at a far off distance. Right. And I would do the same thing to the other eye, and the corneal, the corneal clarity looks good. And looking at the irises, I see no bulging into the anterior chamber. So now at this point in time, I would assess my patient's distance vision, and I would do that using a Snellen chart. I would have my patient stand 20 feet away from the chart, and I would have them read the lowest line possible. That line would give me a fraction, and that fraction would be 20 over another number. So take, for example, that the number is 20 over 40. My patient would see at 40 feet what a normal person would see at 20 feet. Now to assess their close vision, I would do the same process, except I would use a Rosenbaum chart. And I would hold this 14 inches away from my patient's face, and I would also do this test with one eye at a time and then both together. My patient does have contacts, So I would run this test first, corrected meaning with the contacts, and if the doctor prescribed, I would do this test corrected meaning without the contacts. There is also an animal object chart and an e-chart for illiterate individuals or children. And so now I'm going to do a check the peripheral vision using a confrontation test. So I'm going to have my patient cover her right eye, and I'm going to cover my left eye. And so we have across from each other the same eye cover. So I'm going to be moving my fingers, and I want you to tell me when you see them.
No.
All right. And now I'm going to do the corneal reflex test. And so I'm going to have you focus on my finger. And the light reflects evenly in both eyes. And if this test were to fail and the light did not reflect evenly in both eyes, I would do a cover-on-cover test, but just for the purpose of demonstrating, we're going to do that today. So I'm going to have you cover one of your eyes, just pick one, and I'll focus on my finger. And her eye does not seem to drift. I would do the same thing on the other eye, and if either eye were to drift at all, then that would indicate strabismus. So now I'm going to do the assess the 6 cardinal fields of gaze. And in order to do that, I'm going to have you, I'm going to hold your head, because you're going to follow my finger with just your eyes. All right. All right, and I see no signs of sustained nystagmus, and my patient followed my finger very smoothly and nicely, which is good. So now I'm going to turn the lights off and use the ophthalmoscope to assess my patient's eyes. And we're going to turn the lights off because we want our eyes to dilate so we can see more. So and I've already calibrated the ophthalmoscope so that I know that I can see well. And I'm going to come over here. Okay, can you look at me, please? All right. Now we're going to do the other side. Look at me, please. Brace yourself. All right, so while I was in there, I saw that my patient had good lens clarity. I saw a normal red reflex in both eyes, and the retinal color was clear. I did, when I was looking at my patient, see blood vessels, and I noticed that they run nasally to the optic disc. I saw that the arterioles were smaller and brighter than the venules, and I saw a 3:5 ratio of arterioles to venules. My patient's physiological cup characteristic indicates no bulging, and I did not see the optic disc, but if I were to see it, I would hope to see a yellow to creamy pink color, and I would hope to see well-defined borders, and I would hope to see 1 to 1.5 millimeters in diameter. So I also saw the macula when I was looking into my patient's eyes when my patient looked straight at me. And the macula is the central point of vision, and it is 2 disc diameters temporal to the optic disc. So when I asked my patient to look directly at me, I saw a bright reflex that indicates that I saw the macula. So thank you for coming in today, and the doctor will be in soon.